A new report by the Coalition Against Illicit Alcohol, a multi-stakeholder alliance, has revealed a troubling trend in Uganda's alcohol consumption. Illicit alcohol, primarily spirits, now makes up over 75% of all alcohol consumed in the country. This surge poses a serious threat to public health, safety, and economic productivity. The report, based on research conducted in Kampala and Arua, has prompted calls for urgent national action.
Is produced outside the legal framework. We are looking at this alcohol that is produced from our homes, alcohol that is adulterated, alcohol that is surrogate, and then these other alcohol that we find on the street.
Illicit alcohol has become the drink of choice for a growing number of Ugandans. Dr. Kennedy Nwagawa, Director of Arua Empirical Research and Skills Enhancement at Makerere University School of Public Health, has presented the findings.
Study findings, it was revealed that this illicit alcohol has high content of ABV, up to 44%, which is higher than the recommended or the highest threshold, which is 40 by Ministry of Health, and this is directly linked to liver cirrhosis and throat cancers.
He has indicated that Kampala and Arua shows that 83% of the population in these districts rely on alcohol.
You see, those people are the ones that are drinking more of this alcohol.
4 in 10 people consume illicit alcohol daily, especially those in the informal sector, earning less than 500,000 shillings per month.
We have seen that males and self-employed people in informal sector are at risk of drinking this kind of alcohol. But also, we have noted that women are not left behind when men are going to drink. Youth are at risk with 39%, and also over 80% of those below the age of 18, below the age of 24.
Report also reveals that the high consumption of illicit alcohol is majorly attributed to cost affordability, peer influence, poverty, and lack of meaningful awareness campaigns.
One of the focus group discussion from the youth, one of this side, like when I get misunderstandings with my boyfriend, I drink alcohol so that they can sleep. Yes, and then economic factors like affordability of illicit alcohol and accessibility too comes out. From down of the FGD youth discussion with the youth in Kampala, you can see one of the youth side. For example, in Katanga, there are many bars, but the customers are low incomers who cannot get shillings 5,000 a day, but they can afford 500 shillings, which they can spend on this type of illicit alcohol. So we see that the cost of this illicit alcohol is much lower than the illicit one.
The worst comes when these consumers develop the fear to withdraw from taking illicit alcohol.
Withdrawal symptoms, as my colleagues has mentioned earlier on, that people who drink illicit alcohol get symptoms of shakes and what. So it also came out here that these people who had stopped drinking illicit alcohol found themselves experiencing shakes, anxiety, and attempt to quit. So they end up resorting back to drinking to cope up with this.
To address some of these issues, stakeholders, government officials, religious leaders, and lawmakers convened to discuss this disturbing public health threat within the community.
All of us here to work with government, to work with everyone who is interested and on the front line of fighting this ill, so that we come up with a framework, we come up with an action, we come up with, I think, a professor called it a movement.
Coalition Against Illicit Alcohol. It's so nice. But then, during the discussion, there's this a gap. Sexual-related crimes. These people who take illicit how do you call it? Illicit alcohol. You see, they get charged. As they get charged, even they fail to protect their health. It is a cancer.
You are preaching behavior change. But when you come in regulation, when you just tell people don't smoke, it kills, okay, some people can stop smoking. But when you put the law and you put the regulation, then you cut off another percentage, and that's what we wanted. So for me, I'm still that we have a law, we have regulations which can be enforced, and that is where we can go.
Align on policy with public health. Let tax decisions, licensing system, and enforcement mechanism reflect the real risk that illicit alcohol poses. To civil society, take those stories and turn them into action, from boardrooms to border stages, from social media to Sunday services, and making sure that the message is everywhere.
We should implement nationwide awareness campaigns to educate the public, especially youth and low-income communities, on the health risks of this alcohol. The goal is to denormalize the social acceptability of this illicit alcohol, create public pressure, shift harmful norms, and ignite a nationwide movement against its consumption and production.
As Uganda grapples with the far-reaching effects of illicit alcohol, the report serves as both a warning and a call to action. Stakeholders hope the findings will guide the policymakers, health experts, and communities toward long-lasting solutions. This report was compiled by Naguja Serena and Namsoke Naomi for NSTV.